South Korean health authorities are expecting new infections to hit a new record today. Meanwhile, health authorities have announced steps they plan on taking to provide more breathing room for the healthcare sector.
So to break down the latest updates on COVID-19, we have our reporter Kim Yeon-seung here with us in the studio. Yeon-seung, thank you very much for coming in again.
Good morning.
A place as any to start is the daily COVID-19 tally. As Mo-kyun just mentioned, we are expecting another high number today.
Yes, you're absolutely right. So today's figure is actually quite noteworthy because it's the highest late-night tally the country has ever seen. South Korean health authorities tracked down almost 3,000 new infections up to 9 p.m. last night. And with the official morning tally usually adding a couple hundred to the 9 p.m. tally, it's likely that total cases will add up to somewhere around 3,300. You know, ever since South Korea eased measures from November 1st to gradually recover a pre-pandemic lifestyle, there has been a visible surge in cases. The capital city of Seoul saw the biggest jump. Infections rose 43% in the first 2 weeks of November compared to the first 2 weeks of October.
So, Yeon-seung, as we're seeing the increase in the number of patients, is there a chance the country would revert back to the strict prevention measures?
Right. Before I answer yes or no to that question, I want to mention something that came up in the Wednesday afternoon briefing. So health authorities announced the signs that they were looking out for in order to suspend the easing of measures and pivot to a contingency plan. Take a listen to what they had to say.
We're going to comprehensively look at 5 key indices like operating ICU beds and weekly critical cases, among other data. If the country reaches dangerous levels like the ICU beds fill up to more than 75%, we will locate the main reasons behind that and react quickly.
They said they were going to look at 17 indices in total and then every week assess where the country stands in a scale of 1 to 5. 1 being very low in terms of danger levels and 5 being very high. Right now, they say that the nation is at a low or level 2, while the capital city is at a medium level. So every 4 weeks, they're going to compile these assessments and judge if the country needs any changes to the measures before going forward with easing the measures. They have yet to announce what kind of changes they were planning to make, but we'll have to look out for future announcements.
Right. It seems rather odd that the uptick in cases in Seoul has been so high and we're seeing a record number of cases around the country, but still officials are saying it's still rather low on this scale. The capital, of course, slightly higher. But does this mean that the current situation as we have it right now is still essentially under control?
Yes, well, let me give you a brief overview of where we stand as of now. So over 80% of Seoul City's ICU beds are full, while more than 60% are occupied nationwide. Even with the majority of the beds occupied, authorities did reassure that the situation is still within manageable levels, and they were going to acquire as many beds as possible to accommodate the growing number of patients. But this process will take several weeks, and even if the number of beds are guaranteed, if there's still a shortage of medical staff, there's really no point. So what health authorities are trying to do now is expanding at-home care and approving COVID oral treatments. Officials have installed a 24-hour hotline that helps to swiftly transport severely ill patients from home to the hospital. And Ministry of Food and Drug Safety is also reviewing the emergency use of the oral COVID pill from Merck. This pill is expected to be a game changer, with trials suggesting it halves the chances of hospitalization and deaths when taken within 5 days of the onset of symptoms.
All right, Yeon-seung, thank you for that report. We'll talk to you again tomorrow.